Hey, you guys, welcome for day 4 of our March Madness practice questions. We've been on a roll and we'll be doing this all month long, so make sure you're following along so that we can get you prepared for boards, okay? But before we get into our questions, I always like to give my disclaimer. So for those of you guys who are familiar with me, have seen my videos, done any of my courses, any sessions, or utilized any of my resources. Hey, y'all. For those of you who are new to me, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources and tools to assist nurses and nurse practitioners with being successful on boards as well as in practice, okay? But I like to always give this disclaimer because remembering that there are no absolutes in medicines. We treat on a patient by patient basis, but I provide these questions and scenarios and things to get you prepared for your exams, your boards. And we are testing on certain guidelines that we may be doing differently in practice currently because the test needs time to catch up, right? So when I do that, just think about that so you're not having any confusion. I will always say if I'm just giving you tools for practice, I will tell you these are the current practice guidelines. But if I'm doing practice questions and I'm giving you resources to prepare for boards, we are doing what is currently on the exams now, okay? My job is to help you be successful on boards. So I'm going to give you what we're currently doing so that you don't have any confusion. So I just want to put that out there, okay? But let's get into our questions for today. All right, all right, all right. Question number 1 states a patient presents to the office today with complaints of pain to her middle toes. She states that she hosted an event all weekend and was wearing high-heeled shoes. She began to notice the discomfort since then. She states that she has been wearing supportive sneakers since the event in hopes of some relief, but she feels as though she is walking on a pebble. Based on the patient's complaint, how should the nurse practitioner diagnose? Is it A, plantar fasciitis, B, Morton's neuroma, C, neuropathy, or D, sensory neuroma? Take a moment and tell me what you think in the comments. And don't be shy. Tell me what you think in the comments. All right, all right, all right. I always tell you guys to read the stem of the question first so that it slows you down. We're trying not to make these careless mistakes. It slows us down to ensure that we are answering what is even being asked. We approach the question first, reading the stem of the question, and then we can go back and look through the scenario and pick what they truly are even looking for, instead of creating our own storyline or missing those keywords like accept or not in the stem of the question. But the stem of the question states, based on the patient's complaints, how should the nurse practitioner diagnose? All right, so let's go check out what the complaints are, right? So the patient came in, she's having complaints of pain to her middle toes. She says she has been in high heels all weekend, hosting an event. She's been wearing supportive sneakers, no relief, feels like she's walking on a pebble. What is this diagnosis that you should be thinking of here? Is it plantar fasciitis? No. B, Morton's neuroma? Yes, that's your answer. And I always tell y'all different scenarios thinking I call them Brittany's brilliance, and that's just a joke off of me because me when I study, me when I'm learning, me when I'm reading, me when I'm honestly doing anything, stuff that I retain, my mind shifts to something crazy, weird, funny, a song, something to store and retain it. So I things like that I translate and put it as Brittany's brilliance to hopefully help you guys. So when you're taking that exam or something, that you hear my voice saying something crazy and it stands out to you. Hopefully it's helpful. But yeah, that's how my brain works. But in this scenario, when I think of Morton's neuroma, I think, and you probably heard if you've taken any of my courses or heard me teach on this on any of the videos, I think of Morton salt. The blue box of salt with the little girl with the umbrella. So I think like a grain of salt, a pebble, Morton's neuroma, Morton salt. That's what I think of. That's how I remember it. Hope that helps. If not, just count it to my craziness. All right, let's get into our next question. So, question number 2 for the day. A patient presents to the office today with knee pain. On exam, the nurse practitioner holds the patient's knee with one hand, and while holding the patient's foot in the other hand, she brings that foot inward, noting for a click. What test is the nurse practitioner conducting? Is it A, McMurray's test, B, Lockman's test, C, Murphy's test, or D, anterior drawer test? Take a moment and tell me what you think in the comments. All right. Stem of the question. What test is the nurse practitioner conducting? All right. So this patient has knee pain. The nurse practitioner is holding the patient's knee with one hand while holding the patient's foot in the other hand and bringing that foot inward and noting for a click. What test is this? All right. Is it Murray's test? Yes, A. You should select A. McMurray's test, is the classic test that we utilize for meniscal tears, right? So that knee pain, meniscal tear, McMurray's, I say think meniscal, think McMurray, M&M, right? But with McMurray's test, if we hear a click, that's a positive finding. So also that click is a notation. If on boards you see anything about a click, you need to think McMurray's or you need to think MVP, right? Mitral valve prolapse. If they're auscultating heart sounds, noting a murmur and hear a click, it is MVP, mitral valve prolapse, right? But if they are talking about a knee issue, they're talking about a meniscal tear, they're doing a maneuver and they note a click, that's positive for McMurray's test, okay? Now, Lockman test also associated with knee pain, assessing for those ACL tears, right? But, and this is why you should know your maneuvers and your testing that we do, right? So the patient will be supine, you flex at a 20 to 30 degree angle, but you're really assessing for instability because this is looking for a torn ligament, right? So ACL tear, right? So with the hand on the tibia and one on the thigh, they're moving and pulling that knee forward to see if there's any instability. That's the Lockman, not the same as what's described here. C, Murphy's test, that's not a test. Murphy's sign is for abdominal, right? So don't get that confused. It has nothing to do with musculoskeletal. It's GI related, right? Right? With your with your gallbladder, right? And then D, anterior drawer test, is also assessing for a ligament tear. Where we assess ACL and PCLs. So with that anterior drawer test, what you're going to do is have them to have their knee will be at a 90 degree. You A lot of times you will see the person conducting the test sitting on the feet. You're going to do something to support and stabilize their feet, hand behind the tibia again, and you're pulling and maneuvering to see if they are going to have any instability with that as well. But the Lockman test is superior to the anterior drawer test. But anyway, answer choice here is A, McMurray's test. And utilized for meniscal tears, you'll listen for a click. Hear the click, that's a positive sign for a torn meniscus. Okay. All right, all right. Question number 3 for today. A patient has a history of major depressive disorder and is intolerant to SSRIs. The nurse practitioner mentions to the MP student that she is considering starting the patient on Nardil. What education should be provided to the patient regarding this medication? Is it A, no foods high in fat, B, avoid thiazides, C, avoid aged meats and cheeses and alcohol, or D, avoid foods high in fiber? Tell me what you think in the comments. All right, stem of the question states, what education should be provided to the patient regarding this medication? All right, so the patient has major depressive disorder. They're intolerant to SSRIs, so the nurse practitioner is considering starting them on Nardil. You need to know what drug class. I tell you when you're studying pharm, study each system and the medications and the treatments that we do and group them with that instead of making it a separate thing to review, but know your drug names and classes, so even when you get mixed up that you know how we handle that particular drug class or any contraindications, etc., right? And knowing this, Nardil is an MAOI, right? And I do have videos on MAOIs. But Nardo is an MAOI, and if you don't remember anything else with MAOIs, they you have to avoid the aged cheeses, meats, and alcohol. And I tell y'all, I always think of my undergrad farm teacher, and she was amazing. And I think I loved her because she does songs, dances, something to anything, and that's how my brain works. So with MAOI, she used to say MAOI, I can't have my pizza pie. And she said, think about it. With pizza, you typically have the cheeses, the pepperoni, salami, whatever, like aged meats, the sausages, all the stuff on there and some people may have a beer with their pizza or whatever, the alcohol. You can't have the aged meats, the cheeses, or alcohol with your MAOIs. Common MAOIs are your Nardil, your Parnate, So know that. And when you're studying it, just keep those things in mind. Okay. So contraindicated because it causes that hypertension emergency. All right, you guys, that's all for our questions for today. As always, like, comment, subscribe, and be sure to share with whomever you may think may find this beneficial as well. But make sure you meet me back here for more practice questions. We're doing this all month long, and I have over 100 videos, 150 videos, honestly, of various things. If you click playlist, you'll see where I have grouped majority of these into playlists so you can sort through these videos a little bit easier and hopefully making it a little bit easier for you to navigate and get to areas that you may need to review specifically. A lot of my things are short and sweet just to give you the nitty gritty and help you retain it quickly with a little mnemonic song or something. Okay. But if you need any other assistance from the nursing studio, want to do a one-on-one session with me, if you need any review courses, we have self-paced, we have group courses, we have review books that you can get as an ebook, or you can get a paperback book mailed to you. They include the breakdown of things like this, interactive sections to test your knowledge, questions in the back with rationales, pictures, etc. But if you need me, I am here. Just simply call the nursing studio at 803-400-6864. Just ask for Dr. Brittany, and you can shoot us an email as well at the nursing studio with the number 1 at gmail.com. But make sure you meet me back here. Bye, y'all.